Well, there's a lot of issues there as well, obviously. I think there was a really good article that I recently read about how making America healthy again is leaving out folks that are most in need and what they call minority groups, but it's broadly described minority groups. Um, if it means that Medicaid funding is cut, right? Because Medicaid is absolutely a program to support health of Americans. And if we, on one hand, say that we want to make America healthy again, on the other hand, don't have insurance coverage for 20 something percent of Americans, or a reduced insurance coverage at any rate, it's inconsistent, obviously. And the most important fundamental premise for any improvement in people's health is that they have access to health care without worrying about medical debt or otherwise avoiding services because they can't afford it. That there's no question when you look at data after the Affordable Care Act that we have people getting services and care that they would otherwise defer or not get at all before there was that coverage. And people end up in the hospitals. They end up in emergency rooms. So the other fallacy that is just so obvious to me and yet seems to be disregarded is the fact that you can't really save the money that they talk about saving, because at the end of the day, people are going to incur services in a different way. It's going to be more expensive. It's going to be emergency room and hospital services instead of preventative care. And somebody's going to pay for that. As you said, the hospitals are certainly deeply affected when we don't have coverage for people. And it's not just the hospitals, the costs get paid by commercial insurers when they raise their premiums because there's now a loss of funding across the board, across the healthcare system. So the money has to come from somewhere. It's not that people are now going to be healthy who are not otherwise healthy. And it's just so short-sighted. And it's just it's bad policy across the board. It's bad for Americans' health. It's bad for the economy. It's bad for the provider system. It's bad for all the reforms that we talk about around healthcare to allow a significant portion of Americans go without care and go without coverage. So basic.